this episode, we're going to talk about 5 things every caregiver needs to know about good body mechanics when they're caring for a loved one. So, Sin, helping, if you know about good body mechanics, if you practice good body mechanics, as a caregiver, it's going to help extend your caregiving journey and help keep you safe as well as your loved one.
Right. Yeah. Right. And that's something that you always have to consider. You know, we're always concentrated on our loved one, but if we don't take some time to concentrate on ourselves, then, you know, that could be detrimental.
Yeah,
for sure.
Absolutely. So we've got 5 things that we think you guys should know as caregivers about good body mechanics. So we're going to jump right into it. Number 1 is legs are for lifting and back is for support.
So true.
What is that? Sin, tell us about that.
Well, a lot of people don't remember to bend their knees and keep their head and shoulders up, which keeps you from bending forward at your back. You know, the back muscles are very tiny. They're postural muscles, and they were not made for lifting.
Okay.
And when we do too much, and it doesn't matter if you're lifting a loved one or if you're bending over to lift up a laundry basket off the floor, same concept. You really need to be bending your knees and bending your hips, keeping your head and shoulders up, just because the ratio of the type of pressure that's put on the low back when you lift a weight is 1 to 10.
Wow.
You know, so there's a lot of pressure that gets put on the low back when you start lifting weight. So you want to use your legs. That's what they're made for, not your back muscles.
Yeah, that's interesting about those muscles in your back are small, and that they are postural muscles and not bulky muscles to help.
That's right.
Like your legs.
Yeah.
I mean, like your quads and your hamstrings and stuff. That's what that's meant for.
Right.
We always said in therapy, bend your knees and lift with ease.
Yes.
Yeah, that couldn't be probably truer, I would think.
Yes.
Okay. Number 2 is, so the number 2 top things we need to know as a caregiver when caring for a loved one. Number 2 is keep it close.
Yes.
So what does that mean?
So you always want to keep the weight close to your body, okay? Because you have your center of gravity, and the further away that you get that weight from your body, you're really kind of moving that center of gravity out, away from your base of support, which are your feet. So again, you are increasing that amount of pressure that gets put on your low back as you move weight out away from your body. And a very simple way to feel this is if you stand and hold, let's just say it doesn't matter what you hold, 5-pound bag of sugar, you know, it's probably not 5 pounds anymore, is it?
I don't know, probably not.
Maybe 4.
Shrinkflation.
Right. But just hold it right next to your body and then take that same stance, and stick your arms straight out. And you're going to feel a difference. And if you don't, add a little bit of weight to it, but you're going to feel those muscles in your low back start to contract a little bit harder when you move that weight away from your body. And it all has to do with your center of gravity and your base of support. And you want that center of gravity, which in your body is kind of in your pelvic area, kind of in your stomach and pelvic area below your belly button. You want that to stay right over as close as possible over the base of support, which are your feet.
Okay. Which also allows you to bear that weight or all that weight through your legs.
Down through your legs,
not through your spine.
That's right.
Yeah, so again, it kind of comes back to that pivot point, doesn't it?
Right.
Yeah.
Right.
Okay. All right, number 3 is plan and assess.
Yes. So you always want to just kind of assess the situation. And, you know, as caregivers, especially if you're caring for a loved one and you're doing that day in and day out, you pretty much have a routine, but you still want to continue to assess your situation, you know, especially on things like sliding them up in bed or repositioning them in bed. And making sure that you are giving yourself enough space when you're working with them to be able to bend your knees and stick your rump out, you know, and keep your head and shoulders up. A lot of times, especially if you're working and trying to get them up in bed, sometimes if it's a hospital bed, we'll go to the top of the bed. And a lot of times there's not enough space between the bed and the wall or something like that. It's just, you always need to check your space, check your situation, and if you're doing it for the first time,
Yeah.
you need to really assess that person and say, do I have the physical strength to do this on my own?
Yeah.
Because it only takes one time.
Yeah, absolutely. Because that person might be bigger than you.
Right.
In therapy, we would always get we would have these smaller therapists, usually
Right.
females, and they would have a bigger male patient. And I mean, you've been taught in school,
Right.
how to block legs and help
Kind of leverage
and leverage your weight against their weight and everything. But it was always scary for them, which I totally get it. But that person has planned about how they're going to go ahead and get that person transferred, or they've asked for help.
Right. And sometimes that plan involves equipment.
Oh yeah, absolutely. Yeah. And as far as planning ahead, I've noticed sometimes whenever you transfer a person, let's say you're transferring a person from a bed to a wheelchair, I've noticed that you will, when you're planning ahead, that you will bring the wheelchair as close as possible and plan ahead and put it at a certain angle.
Right.
So that, when you do a pivot transfer like that it's not, it's going to be easier on you. I think that would be included in planning ahead as well.
Oh, absolutely. Foot positioning, counting, planning ahead as far as communicating with your loved one.
Right.
Because, if they can help, you want them to help. We're going to talk about that. But, even counting, and saying, okay, I'm going to count. This is what it's going to be. We're going to go on 3. So I'll say 1, 2, 3, and then we're going to go.
Yeah.
Or we're going to go on 3.
Yeah.
But make sure, just like that instance,
right.
You want to make sure that the communication is there and that you've planned ahead to do that.
Yeah. Okay. And number 4 is feet first. Number 4 in the top 5 things that every caregiver needs to know about good body mechanics. Number 4 is feet first.
Yep.
What does that mean?
Then we always talk about, especially in the transfers, when you're transferring from like a wheelchair to the bed, wheelchair to the toilet, things like that, is your feet position. And that means you need to widen your feet so that you have a nice wide base of support underneath you when you are working with your loved one. If you don't widen your feet, you could end up on your seat. And when I say that, I mean, if you don't have a very wide stance and they come up too quick, and this, I've done this before, they come up too quick or they give you a little bit more effort than what you think they're going to, you could potentially, I haven't landed on my rump, but you could potentially fall backwards.
Right, it throws you off your...
Yeah, just throws your balance off. And in that situation also, usually when I am transferring, I not only spread my feet apart, but I do shift one foot back just a little bit from the other.
Right.
And that just gives me that foot that's available to rock back on a little bit, just in case in that scenario they come up a little bit quicker, I start to lose my balance a little bit more. I have a foot that's back that I can rock back onto to prevent my loss of balance.
That makes so much sense. And then number 5 is let them help. That, I think this for caregivers, Sin, is crucial.
Yes, I think it is too.
If you can have your loved one help you as much as possible. Right.
And we know that caregiving is hard, caregiving is time consuming. But for the longevity of caregiving, if you can take that extra time, even if it means giving verbal cues to talk them through step by step what they need to do to help you, it's going to help you, it's going to help them maintain as much function as they can, which in turn is going to help the caregiver. But sometimes it may be, verbal cues that you need. Sometimes it may be tactile cues where I, touch your hand and say, okay, this hand needs to go here, or this leg needs to move here. But allowing them to do as much as they can.
I think there's an independence issue whenever you let your person do as much as they can, and also a dignity issue. I would think, because they've been doing this all of their life, and now all of a sudden they have to have somebody help them. And I think, allowing them to do as much as they physically can and safely can, I think would be a part of adding to their dignity, and maintaining their independence while they're aging in place. So those are the top 5 things every caregiver needs to know about good body mechanics. And so, one more thing that I kind of want to talk about too, Cindy, is that we have on our website, aecorner.com, we have a subscription, a caregiver resource video library, where we have over 200 videos, and it shows caregivers how to provide safe care. It shows those independent people at home, maybe those, what they call them, solo agers at home, how things that they can do for themselves. And so we have, if you go to our website, we've got 3 different plans. One is for the family caregiver, one is for the individual that's aging in place by themselves or with a spouse that they're caring for. And then the other one is for healthcare workers, so what we call the professional caregivers. And they could use that as just another tool in their toolbox, to help. They can set their loved one or set their patient up with or their family caregiver up with one of the videos that they're training on, counted as family training and caregiver training, and do paperwork while their patient's watching the video. Then they can answer questions. So
it's just it's a great review. It's a good thing to leave in the home for a follow-up, because there's always follow-up questions.
Oh, absolutely.
On everything that we train on.
Yeah. So besides the caregiver support, we also have a series about getting ready for knee replacement surgery and hip replacement surgery. I know that most surgeons will ask that a caregiver comes in and sits with them for an hour, but you never have a question till you get home, right? And so what those 2 series do, the knee and the hip series, they try to address those questions that caregivers might have or individuals might have before and then also and after surgery, about getting the home ready to make a successful transition back home. We also have a home safety toolkit. So whenever the hospital or nursing home calls and they say, hey, come pick up your loved one, we need you to come pick them up in 2 days, it helps you. It's a walk through the home with a physical therapist and an occupational therapist, and it shows you things that you could do or take back to the facility and have your therapist go through with you, and it will address those areas of concern for safety that you have in your home. So make sure that you take a look at those. That's at aecorner.com. It's $10 a month. You can cancel at any time,
and you get all of those.
And you get
it's not separate.
No,
it's all you get all
of those series. So, and then we've got another little series called Pick Your Fit. It's kind of some basic exercises that you could do either sitting in a chair, some stretches. You could do sitting in a chair, or some in standing or in supine, lying down in bed. So we would encourage you to go to aecorner.com and check out our video subscription. You could subscribe and it'd be a nice review, or if you're a first-time caregiver.
That's right.
Lots of stuff that you can learn. So
absolutely.
All right. Well, that's all we had for today with Rolling with Ruby. It's episode 5. 5 things that every caregiver needs to know about good body mechanics.